Hey everyone, it's Tim Ria here in studio, Digital Health Summit San Francisco. We just moved this event from last year from San Diego. Awesome last session, especially for if you're a startup. Check this out. Sometimes you're the windshield, sometimes you're the bug, lessons learned from broken business. And you took the time out of your day to talk about your story. This is David Dickinson, is the CIO of Optim Labs and a former CEO of Zio, which is an early sleep monitoring company.
You did get that. Yeah, Zio was a personal sleep coaching platform. We had a digital sleep monitor headband that measured your EEG basically, and then gave you personalized advice based upon that data, how you would change your day to sleep better at night.
So a lot of these digital health business models are more than just about the technology. Usually it's about behavioral change. What was going on stage talking about behavioral change?
Changing behavior is a very difficult task, and I was told years ago to not try to do it. It was too hard. What I believe, though, with Zio and this whole movement we have now is that data done right can be very helpful. So I'd say some of the lessons learned were that give that data to people in the moment of need or of pain. 3 o'clock in the course of a day when you're kind of falling asleep at your desk, why is that? What's the advice I could take now? Yeah. 6 in the morning, wake up, it was a horrible night. Tell me right now what I could have done differently because I feel that pain. So putting the data and information into a context is very, very important. And how you display data is also critical, so I can see these trends and see the problem and see some solutions and guesses that make it better.
So building a startup's a tough deal, right? And so what were some of the other questions for your experience with the company?
Well, in this space right now of this digital healthcare, there is this gray area about, are you just a product for consumers? Are you a medical device? Or are you in between? It's the in between where the art and the science is. And I heard some advice today in this conference about how to do this with regulatory advice being very strong. We use that quite a bit, knowing where that line was of giving advice to people without crossing over into medical device territory. It's very, very important. Aiden talked about that, and it was, he's so right. We created a whole new language for Zio. Didn't exist before that walked that line, because you need to give people, wake up out there. This is something that's not going very well, and push it to the edge. As I said before, you need fear and guilt to change behavior with healthcare, different from just positive reinforcement, and more the wellness or the fitness area. So walking that line is really key.
I always thought I'm an entrepreneur, right? So stay up 7 days in a row, eat poorly. I'm curious, when people reach that last straw, and they're about to break, what's your advice to, where do you go?
Well, people, when they realize that deep sleep is a very different need, it restores your body, physical recovery, builds your immunity, and REM sleep is about brain health and memory consolidation. When you see sleep tips in the context of the phase, it's like, wow, I had no idea that caffeine is killing me. I can see it in my data. I had no idea that laptop use at night would end up really being a problem. I can see it in my data. So the advice is one thing. Seeing the advice in the moment of your data experience is very powerful.
Very cool. So what are you doing with Optum?
Optim Labs is a startup within Optum, which is a major corporation, part of United Healthcare Group. Optim Labs is an open research innovation collaborative where people that join as partners in Optim Labs, like Mayo Clinic and ARP and many others, are able to mine that data to find new breakthroughs for research, for translation clinically, or for innovation, new models to build. It's a very, very powerful resource to answer some of the biggest questions in healthcare.
Cool. Well, hey, David, thanks for sharing your stories, especially on stage in front of the whole audience here. I know that's not an easy thing to do, but it's also a give back that's appreciated by the audience. How do people get a hold of you?
My email is david.dickinson@optim.com.
Fair enough. All right. Thanks a lot.
Thank you.